we have identified risk factors for mental health disorder, and one of them is poverty. If we give money to families, which is directed towards preventative measures like cognitive skills, like reducing bullying in the school, improving the relationship between the parents and the kids, we can improve the development, the motor development and the intellectual development in those kids. So by giving little money to families, if that money we make sure is devoted to implement the preventative measures that I know are evidence-based and that can prevent mental health, is a really nice example of how to save money in the long term.
And you believe there will be a cost benefit?
Oh yeah, there is. I'm pretty sure there is a cost benefit, because the cost of a low IQ is by far much larger than the little amount of cash that these families were given. When you don't have an IQ, you have less social skills, you have less cognitive functioning, you don't get that well-paid in jobs, you're more likely to abuse drugs, you're more likely to end up in jail. So it's a justice system, is the public system. You're less likely to be productive and come up with good ideas that improve the lives that we have. And there are other unusual experiments that we are now dealing with terms of ethics, like paying patients to take the medication. I think we're ready for the ethical discussion. I'm not 100% sure we're ready to start doing that, but for sure the ethical of why as a society should not invest money in people that are extremely costly, right? And we're not forcing anyone, we're just giving a bonus to do something that overall will make that we pay less taxes. We have good literature showing that we can reduce risk factors to develop a mental health disorder, but those interventions have not been implemented. The clinicians should take more initiative in translating that knowledge to the people who are responsible to put those interventions in place. Most of the interventions in mental health pay off in the long term. So and they are not perceived as diseases that kill. So even though some of the interventions in the cardiovascular oncology pays off in more than 4 years' time, which is the time that politicians are in charge and want to be reelected, but people easily understand that a heart attack kills or breast cancer kills. They don't know the mental health disorders are not that easily translated into mortality, and that's why politicians don't prioritize mental health disorders. First, because it takes a lot of time to see the payoff, and second is because they are not perceived as disorders that kill, which is not the case, as we know that, for instance, people with schizophrenia live 20 years less than the general population. We have the expertise, we have the research, and now we need that to be implemented in interventions that will make that the quality of life of people in Europe and worldwide is better because they have less mental disorders.
Our past president, Ruud Mindera, he often says perhaps the implementation is more difficult than the research.
And he is absolutely right. Research depends on people who are devoted to do it, people that are enthusiastic, people that love their job. The implementation is not that always the case.
Thank you very much.
Thank you.